Hey everybody, we're going to start letting folks into the room for our webinar on data quality in Wraparound Fidelity, and we'll get started just about 2 minutes past the hour. So feel free to use the chat to describe who you are and where you're from, and that way folks can have a little bit of introduction to those who are in the room with them. That's always kind of fun to see. So yeah, while you're waiting, if you could let us know in the chat a little bit about yourself, and we'll be starting in just a minute. Hey everybody, once again, we'll be starting in just a minute. It would be great if folks could use the chat. I think it's working, although I don't know if I can see what people are putting in. I don't know if I'm doing something wrong. But it'd be great if folks, assuming that the chat will support this, could let their colleagues who are in the room know who you are and where you're from. There we go. Thank you so much. Hi, Shar. Been a long time. Got folks from Indiana, California, South Carolina. That's what I love about these webinars. We know that wraparound is now a national phenomenon, with just about every state in the country having some sort of statewide wraparound initiative. It's wonderful to get to host these webinars. Thanks to the University of Maryland and the Institute for Innovation and Implementation. I'm going to go ahead and get started and introduce the group while folks introduce themselves to one another. I'm seeing Idaho, New Mexico, Pennsylvania. So cool. So I'm Eric Bruns. I'm sitting here in Seattle. There's a little bit of wildfire smoke in the air, but other than that, it's a beautiful fall day. I am with the University of Washington Wraparound Evaluation and Research Team. And I am joined by two colleagues on our University of Washington team, John Olson, who is our research scientist, and Taylor Berntsen, who is our incredible data specialist, now working from afar, but doing an incredible job managing an entire statewide fidelity data collection and analysis effort. And we are all joined by Heidi Gross, who is the Director of Wraparound Implementation at the Indiana Division of Mental Health and Addiction. We have Heidi here because I'm just going to put it right out there here at the start. State of Indiana has been working with the National Wraparound Implementation Center and UW-WIRT to make sure that they continue and strengthen their incredible history in that state of using data to manage and to inform their wraparound statewide efforts. And so Indiana is going to be a real focus of our webinar today, which is focused on getting good wraparound and other kinds of data to manage and drive your wraparound initiative. Finally, we have Emily Bradshaw here from the National Wraparound Implementation Center at the University of Maryland, who is a coach working with the state of Indiana. And so Heidi and Emily are going to share their experiences and success stories in being able to use the data that Indiana has successfully been collecting with Taylor and the UW Wraparound Evaluation Research Team's support. Have I successfully advanced the slide? Okay. So what we're going to do today, this is one of our both favorite and least favorite topics in the work that we do at the University of Washington. I'm a researcher theoretically, but really what it seems like I spend most of my time doing is trying to ask, how do we get data to make sure that we're keeping initiatives on track? We certainly make an incredible effort largely spearheaded by Dr. Olson and others all across the country, our collaborators, to translate data that gets collected in wraparound implementation into research that the field can use, and it fills the systems of care and wraparound research base. So what we're going to do today is talk about this issue of trying to keep something that I think is just frankly a tragedy, is when folks dedicate thousands of hours of effort, sometimes, hundreds of thousands, millions of dollars to getting data that is really not very useful because it's not complete. They haven't invested in the right kinds of activities to make sure you're getting high quality data. Because as the little title slide showed, if you have faulty inputs, you're going to get faulty outputs in terms of what you actually can analyze and use with respect to those data. So today we're going to talk about Indiana's experiences, making sure that they achieve high data collection response rates and good high quality data that can actually be used to manage an incredible statewide wraparound initiative. And they're going to give examples of how the data are used by the provider organizations, the state, and the trainers and coaches such as Emily at the National Wraparound Implementation Center. And then finally, if we have time, I'm going to talk a little bit about how we've designed a new fidelity data collection and reporting system that some of you probably are using, have probably heard about, called Rapstat, to try to support high quality data collection. And we'll save time for Q&A at the end, but we would welcome you to put questions into the Q&A little dialog box there within Zoom, and we will get to them as we go if they are relevant to the flow of the show here. So John, feel free to just chime in with anything that looks good. So let's get started here, but first, no presentation, webinar, other kind of discussion of data would be complete without a Dilbert cartoon. So let's just throw one up there, right? Here we've got Dilbert's boss. Unfortunately, this just feels too much like the lives that we live here at the Wraparound Evaluation and Research team. All of our data is grossly inaccurate, but I need the data in order to manage. If I just concentrate hard enough, I can forget the data is bad, and then I can use it. This, unfortunately, is just a little bit of reality out there sometimes. We've got folks who are collecting data in ways that don't give them something they can actually manage with, because it doesn't actually reflect the real world of what's going on with families and kids. And this is just basically this kind of suspension of disbelief that we all too often live in human services, and we have to get past it. So that's what we're going to talk about today. So just a little bit of context. Why is it that we think that collecting fidelity and other kinds of implementation data is important in wraparound? And because John spearheads a lot of this effort, I'm going to hand it over to him real quick.
All right, great. Thanks, Eric. Yeah, for those of you who have been to some of our previous webinars, you've probably seen these slides before, our favorite little pill diagram here. So maybe a little bit of review for those of you that have seen us before, and hopefully some new ideas for those of you who haven't. This little pill diagram does a nice job summarizing some of the implementation science that fuels the work that we do when we think about measurement of wraparound outcomes, fidelity, systems factors, and all those kinds of things. So just to take us through this very, very quickly, we all want to get to that far right side, outcomes for youth and families, right? That's the purpose of doing this work, is to hopefully see positive outcomes for those that we are supporting. And we have a whole host of measures to look at outcomes, right? But before we can get to outcomes, we need to implement something and implement it well. So that's where you get to that little kind of triangle arrow in the middle of fidelity and implementation success. We want it wraparound to be implemented with fidelity to the model, with high quality. And we have measures to do that as well. That's actually what we're going to focus on mostly today, is looking at the WFI-EZ, the Wraparound Fidelity Index. But we have a whole host of other measures as well. But it's important to note that just measuring fidelity and outcomes alone is not enough, right? All of this work is embedded within systems, right? Those outer contexts, which house the provider organizations, those inner contexts, right? And the culture, the leadership, and the climate within those inner settings. There's characteristics of teams, characteristics of wraparound itself, and a whole set of processes that make this all happen. So I want to keep that in mind as we talk about fidelity today, that fidelity is also related to all these other factors. We've done a lot of work on our team to start to untangle some of this, this complexity. So we can go to the next slide, Eric. And talk a little bit about some of the work that we've done, where we've used some of the data, the fidelity data, and combined the fidelity data with other things. We've just completed, actually it's been a while now, pandemic time always makes it seem like things are more recent than they really were. Our meta-analysis, I'll talk about just very briefly, some benchmarking work that we did to help us determine what really means high fidelity when we get these scores from, say, the WFI-EZ. And then a little bit of information about what matters at the program and system level. And some of that will come back around to when we share some actual data towards the end of the session today as well. But for now, let's go to the next slide and talk really briefly about some of the meta-analysis findings. And what was striking on our meta-analysis is, first of all, we saw decent effect sizes looking at wraparound compared to treatment as usual across a whole host of outcomes, mental health symptoms, functioning, residential outcomes, so on and so forth. What was most striking was when we looked at those, and I'm going to argue there are very few, unfortunately, studies that really looked at fidelity, how the quality of implementation impacted the outcomes. But when we did drill down to those several studies that looked at implementation fidelity and how that related to outcomes, not surprisingly, we saw some pretty big differences. Those sites, those studies that found that the wraparound providers implemented with high levels, or at least even average levels of fidelity or higher, had much larger effect sizes than those that had below average fidelity. So it really reinforces this point that implementing wraparound well is important. And to do that, we also need to track how well we're implementing. So that brings us to some of the work we're going to present today. And if we go to the next slide, we can talk about the WFI-EZ. I think all of you are here because you know what the WFI-EZ is. It's a self-administered survey. We have caregiver, care coordinator, youth, and team member forms. It can be completed on paper, online. There's 3 primary sections plus some additional questions about wraparound practices and procedures and processes in general, but we oftentimes focus on the experience in wraparound. There's 25 main items, and we also have satisfaction and some outcome items as well. If we go to the next slide, you can see that we've developed, we've used data. I'm going to kind of drill home this point of having good data has allowed us to do a lot of this work. So we've recently updated our benchmarks to help us interpret our WFI-EZ scores based on a nationwide sample of WFI-EZ data, where we had high quality data collection methods, good response rates, not a lot of missing data, and those kinds of things. And then we can use these benchmarks to help us determine whether or not we are at high fidelity. And we didn't just do you're either at high fidelity or not, but there's different gradations, right? High fidelity, adequate, borderline, and inadequate. And what we did was a pretty systematic process to look at which scores indicated better outcomes, and thus and also map that back onto other indicators of fidelity, so that we can look at the total WFI-EZ score. For example, 80 plus on the caregiver and youth form would indicate high fidelity, 75 to 79 would be adequate, so on and so forth. And then we have slightly different benchmark numbers for the different subscales that comprise the WFI-EZ as well. All right, let's go to the next slide. We'll come back on some of those benchmarks later in the presentation. You'll see some of those in action. Other ways we've used WFI-EZ data. Many of you are familiar with the wraparound implementation standards at the program level, what we affectionately call the WISP, which has been developed by our NWIC colleagues. And this slide shows that just a few of the WISP kind of constructs or subscales and how they are related to WFI-EZ scores. So what we see here is when we have high levels of leadership, meaning executive leaders who are engaged in the implementation processes, we see higher scores. When we see care coordinators who are highly engaged, who have regular meetings with families, we have higher fidelity scores. And perhaps one of the more interesting ones, and one of the largest effects, is those where we see staff satisfaction. Care coordinators who are satisfied tend to have higher fidelity scores. So again, not to kind of keep belaboring the point, but having good quality data collected from the WFI-EZ, good quality data collected from the WISP, we can start to look at some of those larger effects, those kind of program level intersetting effects on wraparound implementation as well. Okay, one more data slide I'm going to go through really quickly. We could do probably a whole webinar on kind of deconstructing what these data actually mean. But just to show some interesting things we can do, again, when we have good high quality data. We tracked early on in the pandemic, we were interested in looking at fidelity scores over time. So we tracked fidelity and you see kind of flat, it went down a little bit in those months leading up to the pandemic. Then we see this little blip, this sort of increase in both fidelity and satisfaction, but then regress back down to the mean. Again, we have a variety of theories on why this is the case, but the point I want to make in today's session is just that having these data allowed us to take a look and be responsive to large external trends like a global pandemic that were going on in the world, and how wraparound implementation was responding, okay, over time. So I went through that very quickly because I really want to get to some of Taylor's and our Indiana partners pieces of this, but I'm going to hand it back to Eric to kind of sum some of this up and then move on to kind of the heart of the presentation today.
Thanks so much, John. I know that was a lot to digest. We've been presenting on a lot of those findings in other contexts. The context we're presenting them in here is that, frankly, in systems of care, and not just children's mental health, but mental health and behavioral health in general, there just isn't much research that confirms some of the things that wraparound data have been able to confirm, that certain kinds of organizational standards really drive the experience of families. You have satisfied staff, you have much higher quality service delivery, for example. If you have good leadership, you have better service delivery, higher quality service delivery on the ground level. What state were those data largely coming from that allowed us to find those trends? It was the state of Indiana. And the reason the state of Indiana is turned to a lot of the time for us to inquire about these things and to do things like win awards from the National Institute of Mental Health for actually doing policy relevant research, just a little, try not to break my arm patting ourselves on the back here. But, wraparound is able to lead in these kinds of areas of implementation science and kids' behavioral health when we have high quality data. So you as a organization, I'm seeing like 30 states represented here, as a state kind of administrator, and us as researchers are all going to benefit from having high quality data collection. The point here is that all of that research was made possible because we had high quality fidelity outcomes and things like organizational level data. If you don't have that kind of high quality data, you're not able to do that kind of work. So here's the alternative that I think is all too common again in our field. More Dilbert, right? I didn't have any accurate numbers, so I just made this one up. Because studies have shown that accurate numbers aren't actually more useful than the ones you make up. We don't want to actually have a credibility gap by falling into this trap, right? Because people really often just do not have data that they can hang their hat on. Here are some examples of the garbage in, garbage out kind of phenomenon that we just see all too often in wraparound and systems of care. We collect data from just a few easily contacted families, and then we run a report saying, hey, look at our fidelity data. It's really high. Yeah, that's because you just got all the families that are really easy to contact, probably the ones that have less challenges in their day-to-day life, and the ones that you are able to more easily engage over time and get a hold of. That is not representative of your actual organization or initiative. That's a convenience sample. We only get follow-up data after getting baseline data on 12% of your sample and say, here's our outcomes. Again, this is losing all of your families to follow-up, but people will run reports and say, these are our outcomes. These are not data that we use in our research. We can't, because it is not actually representative of reality. Only using measures that improve for everyone and calling it your program outcomes. This is regression to the mean. We know that when families and clients come to us for help, they're usually at their kind of highest level of stress. And so everybody tends to improve when you're at your highest level of stress, just regressing to the mean. We need to have something that actually tells us what is a comparison and not just say this is because of our program. So our vision, and Indiana's as well, is that wraparound initiatives will have high quality data that they can trust and use, and will grow the number of programs and initiatives that we can rely upon to do rigorous and useful research for systems of care and wraparound. So how did Indiana get what I think is just an extraordinary, we're talking about a statewide, many hundreds of enrolled families, and they are able to get 55, 60, 65% response rates, which is really outstanding and allows us to actually say this is representative of the whole state and the individual organizations within it. Taylor has been really spearheading this work. I'll hand it over to her.
Hi, everyone. Thank you for that lovely intro. Yeah, so I am a research consultant on the Wraparound Evaluation Research team. And you can go to the next slide, Eric, if you'd like. And yeah, I've been evaluating wraparound care for Indiana State for about 4 years now. And so through this process and many different edits and iterations, we really have found a system that has produced some of the best response rates and fidelity research on a state level, and definitely on our team. So my kind of approach to this part of the conversation is really boiling down what has been integral to that success. And what I've come up with is consistency, varied outreach approach, as well as a flexible approach, and the use of incentives. So Eric, you can go to the next slide. So first, let's talk about consistency. As we all in the research world know, consistency is key for producing reliable data. It's also key to having an approach that does not have just convenient sampling. So a part of the consistency that I utilize is always having a random sample and doing everything that I can to get results from the participants that I've randomly selected, or the families that I've randomly selected. And I'll get more into the nitty-gritty of my specific outreach process in the next slide. But in sum, it is crucial for anybody performing these fidelity evaluations to stick to a consistent approach. And that doesn't mean deciding on an approach and then sticking to that no matter what, no matter if it's not proving to be successful or if you're having a low response rate. There will definitely be some trial and error in the beginning, and not every organization is the same. Not every organization has the same amount of bandwidth, financial resources to do the approach that I'm about to detail. But whatever approach you do decide on, it's really important to maintain that consistency. And really some of the most rich and informative qualitative feedback we've gotten is from those caregivers and families who were not satisfied with the process and who sometimes were very hard to reach. And so all that to say, that's the data that we can really look at and say what needs to change, what's going well, and what is possible to even change based on the families that aren't having the ideal experience. So in a few slides, I'll show a sample spreadsheet of how I personally keep track, but I wanted to just note that it is really important to keep track of not only what's most successful in terms of the time of day that you reach out to families, the type of outreach that you use, but really just the entire process of this whole data collection process. Keeping track is key. I did add a note here that it's easiest to text families. That's a great option that we've recently discovered can be possible through my specific outreach approach, but it's not always free. And so we want to always make sure that we ask for consent before contacting. And part of my personal process is it involves having a consent form when families are first signing on to the wraparound care coordination process and experience that they will consent to being contacted. So my random selection is not everybody who's in wraparound in Indiana State. It's really those who said, yes, you can contact me. Here's my email or my phone number. And yes, you can, or no, you cannot text me. So Eric, you can go to the next slide. So in terms of the varied approach that I use, we really nailed down a structure in the first few months of this process back in early, I think time is COVID. I don't know time anymore, but it was a long time. It was like 4 years ago. And really we made some substantial changes in that beginning phase, which were so critical in getting the response rates that we now have. So again, this is specific to the bandwidth and resources available to your team and as well, to my team in this evaluation, as well as Indiana State. But detailing this structure will hopefully spark ideas for you and your organizations within the bounds of your own resources. So the approach that I utilize is a least to most effort approach. Of course, I don't want to expend more energy on this than I need to reach families. Of course, I will do that. But first and foremost, we reach out via email. So not every family provides an email address, but for those that do, I do send out a Qualtrics version of this survey that I would then use over the phone with them for those that did not respond via email. Definitely emails are easier than cold calling strangers. And like I said before, Indiana organizations that provide wraparound services provide the families with the consent to be contacted form. So that's how I get all the information that I need to reach out to families. And that's what I use to create my random samples from. Again, those who offered email addresses will be contacted, and those that do not, they just fall into the next bucket of those who I'm going to attempt to phone call. For the phone calls, this is kind of the bulk of the survey, the data collection that I do. For best success, I like to keep track of my efforts, and I'll go through in the next, I believe it's the next slide, a sample spreadsheet of how I keep track. That has been really helpful to knowing when is the best time, or when is, looking at trends. Okay, this week I called people Tuesday at 1 p.m. and then next week I did Tuesday at 1 p.m. and it's just not really a good time. So maybe the next week I'll try Friday at 1 p.m. and just kind of doing that over the course of months, seeing what has been the most successful. Other things that I know for the phone calls is to be as familiar as possible, both with your approach as a human and also in terms of familiarizing them with you without having met you. So the way that I do that is within the first few seconds of the call, when people answer, I name drop their specific facilitator and their agency. I also find it very helpful to name that everything is confidential and that there is an incentive offered. And again, we'll get to incentives and bandwidth for that within your organization in a couple slides, but that has been super helpful in kind of keeping them on the phone. And also the last bullet there, just being you. When I was first starting this work, I was very nervous to call people that I didn't know. I had this fear that people would be yelling at me or be, saying that I'm a spam caller and hanging up on me. I just had all the worst case scenario fears. And over time, as I've become more comfortable with it, I don't utilize a script personally. I try to be as personable as possible. Often with those that answer, a lot of times I can tell how skeptical people are when they answer the phone and just in the tone of their voice. And I just try to be as human as possible. And sometimes I joke and say, I promise I'm not spam. Your care coordinator, Jenny, should have let you know I'd be reaching out. And, does that sound familiar? And even if they say no, they know Jenny, and I know that Jenny is their family's care coordinator. So they're already more familiar with me in that sense. And then we can go from there. With the phone calls, I call families up to 3 times. So, if they don't answer on the first 2, I'll do one last phone call before I drop them into the last bucket, which is the snail mail option. And another note on phone calls with voicemails, I try to keep it brief. Again, all the notes I said before, name dropping facilitators, being personable. But I do also I try to highlight in the first 5-ish seconds of the voicemail that there is an incentive. And I've found that really helpful. And I also highlight the texting option. So for my specific work, I work remotely. So I have a separate phone. It's not my personal cell phone number, but it does have the option for texting capability. So I highlight, if talking on the phone is not something that you can do or are interested in, I totally get that. You can give me a text at this number and just let me know your email address, and I can send you the gift card and the survey via that route. And that has actually really helped to just even highlight in a voicemail that you can just text me, because I think we all can relate to getting a call from a stranger, and just even if you do have the time, not wanting to even answer. I personally don't answer calls from numbers I don't know. I don't know how many of you all can relate, but so lastly, for those that have been unsuccessful, reaching them has been unsuccessful for me. It's still important to reach, like we said, we want to avoid convenience sampling. So that is the last ditch effort of reaching families. And I didn't include this here, but prior to my sending out these packages to families, I reach out to the care coordinators of these families and say, hey, just so you know, your family, and they should know, because we do survey the facilitators as well. This is a multi-pronged effort where we survey the caregivers as well as the family team facilitators. So they should know that it's coming. But I just basically let them know, hey, your family, we've been trying to reach them, this family with this youth. We'll be sending them a package. If you could let them know, that would be great. Please let me know if they're no longer in services, because sometimes, and you'll see later with the qualitative feedback that we've included here, sometimes families sign the consent form and then they never start, or they start and they only do a month and then they stop. So it's important to know, is this worth, sending out this gift card and these things to this family if they did not even partake in wraparound? So once I've gotten the go-ahead from care coordinators, I send this package. The package includes a cover letter. It's very brief. There's no psychological or research jargon. It's very kind of how I'm talking right now. This is the reason for this is to make sure that your family and other families are receiving the best care that they can with regard to their wraparound services. And it helps us know what we can do to improve if that's not the case. I also include a pre-addressed and stamped envelope, making it as, hopefully it's easier to just do it than to not. And then as well as the gift cards. So it's kind of that honor system approach. And that's been very helpful as well. So
hey, Taylor, people have a great question, which is, what are other ways that you use the care coordinators to try to facilitate getting the responses from the parents, for example?
Yeah, that's a great question. So this is something that Heidi is very helpful with. Once every probably quarter or so, Heidi sends out this helpful email to organizations and and the care coordinators, the staff of these agencies, and basically just says, hey, this is an effort we're still doing. Please let all your care coordinators know that the families might receive something, and remind them of the consent form that they filled out at the beginning. The consent form that they sign has a little bit of information about this, that the reason that the person is from the Wraparound Evaluation and Research team. There's an incentive. So hopefully that sparks a memory. But also when I reach out to facilitators to get the WFI-EZ facilitator form, there's a note in that email as well saying your family was selected, so they will be included in this effort as well. So just keep that in mind. The goal is that they will remind the family, like, hey, remember that consent form that you signed at the beginning? You're probably going to be reached out to. It's not spam. This is a real person. They're completely separate from me, so be as honest as you'd like. The feedback will never get back to me. That's a super important part of this work, is that, and what I reassure them over the phone is that I have no dog in this fight. I'm really here to hear your perspective. And it's really just to make sure that yours and future families get the best services that they receive.
Yeah, we're pretty convinced that having that kind of third party really does get more honest and straightforward responses. Hey, another question that's come in. How much is your incentive?
So our incentive is, so just to reiterate, at the beginning of this process, we did not offer one. And so I'll show in a couple slides what the change was with that. Our incentive for the Indiana effort is $10. It's a $10 Amazon gift card. So based on the amount of time the survey takes, and that's another thing that I highlight in the phone calls and in the text, if I ever do text families, is that this really takes, I mean, 10 minutes, usually at max. Oftentimes it'll take more because we'll get into the conversation and I want to get that qualitative feedback. But it's a really nice size incentive for the amount of time that they're spending with me, or even online. The online version probably takes around 5 minutes to complete. But again, I know that that's not something that everybody can do and every organization can do. But this slide, okay, so this is an exact replica of the spreadsheet that I utilize in keeping track of phone calls. Obviously, I've changed the information, but I just wanted to show you kind of what my process is. And I'm happy to send this out after this as well, if needed. But you can see the first youth, that green bar, is somebody who I successfully reached, although this was not a phone call. This was somebody who provided their email address and they completed via Qualtrics. I never talked to them personally, but I have data. And then it's just important for me to keep track of sending the incentive after the fact to those families, because it's easier to remember if I personally talk to them. The next one, Kris Jenner and Kim Kardashian. I tried to reach Kris Jenner 3 different times. I left 3 different voicemails. Totally fine. She's busy, but she never declined. So I'm going to go ahead and send the package. And then that would include, that package of the envelope, the survey, de-identified. Always make sure it's de-identified. So I use these little codes on the very left side. And then the last one is somebody who picked up and they declined. They didn't want to be a part of it. Totally fine. So this is just how I keep track. Also, you'll notice in the attempt 1, the first green column, I keep track. I don't do as much anymore because I've really figured out when is the best time to call, but I used to keep track religiously of when I was calling on what day. So if it's 3 p.m. and people are answering, or it's 50-50, okay, 3 p.m. might be good. But if it's 9 a.m. on a Friday and no one's answering, I'm going to want to know that for the next month's sample. I see a question. I don't know if that's for me, but I did see one and now it just disappeared.
There's some great questions. One is, what's your random sample rate?
That's a great question. That was also something I believe, no, actually that's been the same the whole time. So we do a 40%. So essentially, when I pull these consent forms, they are for people who started or who signed the consent form. I put it in quotes because some people don't start right away, but the attempt is to survey people 6 months from when they signed the form. So 6 months after when they signed the form, people are grouped into months. So if they signed it in December, they'd be reached out in June. I think that's 6. I always get confused. That's 5 or 6. I think it's 6. So they'd be reached out in June. And I have a whole list of everybody who signed a consent form in December. That becomes the master list of that month. And then I randomly select 40% of that list. And that's how I go about doing that. And that's the rate. So it ends up being, sometimes the monthly sample is 7 families and sometimes it's 25. It really just depends on, some months are heavier for people enrolling and some are less heavy.
Heidi put an important point in, which is that the families opting in or out to the fidelity and satisfaction surveying is done at the application point for services, right, Heidi? So it's important to recognize that it creates a big barrier to actually achieving this representativeness if a consent process poses a burden or an extra step. So at the very least, I would suggest making sure that it is kind of part of a comprehensive intake process, so that there's not some sort of, and now we have to get a consent form before we interview you or survey you. That's basically going to just totally destroy your response rate, because adding that step midstream is going to be a barrier to a lot of families and just be that extra step that folks aren't able to complete.
And
Just-
I think that that's another way of getting convenient sampling, because people who are not satisfied are not going to want to consent to anything else wraparound related.
Exactly.
So it's really
Yep.
important for that to be a part of this onset, or not onset, but you know what I'm saying. The
Enrollment process, yeah.
Thank you, that's the word.
I think the other thing to recognize is that our IRB, our institutional review board that oversees human subjects protections, would never expect written consent for an evaluation that's mainly, as this is, intended to improve the program. Written consent is really not something that's an expectation of all human subjects protection conventions, but a lot of folks like to get those actual written consents before they do these kinds of processes anyway. But just to say, it can be a barrier, and gotta like ask, what's the purpose of actually putting that barrier in front of folks? Is there really some sort of legal or other kind of human subjects protection step that's needed there? This is not confidential information, and it's not for the purpose of research. It's for the purpose of improving the program. Okay, back to you, Taylor.
Yeah, and I will just highlight one last thing on that. That's why I put the no about the texting. That is one thing I think it is important, because this is not required necessarily, as Eric is saying, to get this consent, because it's not protected information. It's completely confidential, and it is for that effort of non-research. It's for improving your agency or your organization's mission and success. But texting might cost families money, so of course we don't want to burden them with that. But yeah, let's get back to this. So in terms of I believe it was my second to last bullet point at the beginning, being flexible. As you probably noticed from my last slides, it is very important to be flexible in not only creating what will then be your consistent approach, but that type of outreach. Not every family and not every organization are a one size fits all. So being flexible with how you reach them will lead to highest response rates. I have an example, perhaps, and this happens all the time. Perhaps you reach a family, but they can't talk and they'd like you to call them later in the day or tomorrow. And it wasn't really in your work plan, the way you scheduled your week to be. But they did answer and they were willing. So maybe switching around your tasks so that you can call them today at 4, and if it's 2 p.m. or something. Or perhaps you're realizing that the script that you're using or the approach that you're using when you call families is not leading to any callbacks, or it seems unclear to them what your purpose is. Just being flexible in that approach and being willing to change it. I think if we had been rigid with our approach from the first month of data collection, we would not have the results that we have today. So something that I personally did that was really helpful was that change in my script versus non-script. Again, a lot of that was because I was very nervous at the beginning, and cold calling is nerve-wracking. But once I kind of let go of the script, I made a conscious decision. I know what I need to talk about. And a lot of this is just learning over time, but really highlighting I'm not spam. There is some sort of incentive, even if it's not financial incentive, and I'll get into that in a minute. And name dropping people that they do know and are in connection with. I believe, yeah, okay, then you can go to the next slide. Lastly, incentives. So obviously, major disclaimer, every organization is different, bandwidth is different, communities look different. So options for incentives that are community-based, everything is different. So this really is going to be something that you and your organizations work through together and seeing how could we make this sort of process work in our organization. But with us, you can see the incentive addition was so helpful. You can see before we provided incentives, we were averaging about a 35 to 40% response rate. And now we're consistently at 55 to 60%. And that's as an average. So some months are 80%, but it never really drops below 55 ever since we started offering incentive. Another little disclaimer though, as I've gone along in this process, I have gotten more comfortable. I've kind of edited that call script. I think that those things did contribute, but of course, people love to receive something for their efforts and for their time. So I think that this was probably the most beneficial thing that we did. But perhaps a $10 Amazon gift card is not something that you can offer every family. That's completely understandable. We're very lucky to be able to do the work that we do with Indiana, and that Indiana really invests in this evaluation research to better their wraparound care. But maybe donations from the community, something that you and your, the care coordinators and their meetings could change up as a sort of incentive. This is something that you'll have to figure out with your organization. But
yeah, and I'll just be real straight. I mean, we pay research team members tens of thousands of dollars a year, and sometimes, so what's $10 a gift card when we're talking about the amount of money we're paying for wraparound and for our data evaluation teams and so forth? We're in an era where wraparound is paid for by Medicaid and other sources at millions of dollars a year. We need to get data that actually makes sure it's staying on track.
Yeah, and so that's kind of the rough cut version of what I do in terms of the data collection process and obtaining those response rates. And now we'll get into a little bit of the the exciting the fruits of our labor, what comes from this work. And I do want to say, as a disclaimer, before we talk about any of these charts that we're going to present, this is the data that we utilize and that I report back to Indiana and to NWIC to use for coaching and to use to disseminate to their organizations. There are criteria for who is included in that. So I'm not going to add organizations that only have 4 families that have responded. There's a minimum criteria of who is included in these, just so that that there's actually a substantial amount of feedback. And so just wanted to say that before we get started with these.
Yeah, point being is that there's more than 17 organizations in Indiana. Only those that actually get good response rates are invited to the party of learning together about how certain provider organizations are getting high satisfaction and fidelity and others might improve. And I would say, I don't know, maybe Heidi can talk a little bit about how do you even start the process of making sure folks are aware of what the expectations are for supporting data collection and getting those high response rates and bringing them into this learning community that this example provides here.
Yeah, and I know Emily was going to kind of highlight how this is helpful on the NWIC side, but you can really see from this chart, we're able to really look at the fidelity scores by organization. And granted, like we've said, in Indiana State, there's 29 organizations that I call or that I reach out to. I mean, I guess there's a couple that I haven't because they're small and
They're new.
They're new and they haven't made it into my random sampling yet. But yeah, you can really see this is so helpful to report back to Indiana State and let them know what is going, who not only has higher response rates, but what is the fidelity looking like by organization.
Just to kind of add in here, Taylor, with this slide, one of the things that we do with the data is we give it back. So I think that's something that should be said, is that it's important for us to gather it, to analyze it, to be able to shift and make change. However, it's important for us to give that data back to the organization so they have it. So when we talk about organizational implementation within that inner, and then we look at the outer context, within the pill that Jonathan had showed us earlier, that expectation is there. So we want to start people off knowing that this is how we roll, that, collecting data is what we do so we can impact change. We know that there's families and youth on the other side of this that can't wait for us to get it right. So we need to move quickly. But I think too, when we give the data back, de-identified in this, it creates this competition. So a lot of our organizations in Indiana are, we want to be the best wraparound facilitation organization. We're going to have the highest comment. We're going to have the highest, they're very competitive folk. And so by giving them back the data and putting it in their hand, really helps support them in taking that to their leadership, and it really supports them in setting their own goals around how they and where they are with their implementation. If they're in pre-implementation, if they are in sustainability, it just really helps set some goals for these organizations as well to do better. So on the other side of it, families get good quality, high fidelity care.
And the flip side of the competition piece, I imagine, I'm not in one of these organizations, but is having, of course it's de-identified, but being able to see proof that there are other organizations in Indiana who are crushing it or who are not, and where do I fall in that? And I wonder what's different about those organizations, and really taking a more, being able to compare in that way, you're able to see more than just your own organization, and that in and of itself is very informative.
Emily, you want to chime in a little bit about ways you use any of these data at the organization level for coaching?
Yeah, so I think one thing that I want to point out is just the tremendous work that Taylor has done with not only partnering with Indiana, but with NWIC. And so I think this idea that we do this kind of plan, act, do approach in all stages of implementation. So in, we're NWIC and DMHA meeting together to look at this data and then being able to give it back to supervisors and leadership, and then even taking it to coaching with care coordinators to say, what do you think about this? Like, what's really going on here? And so the WFI-EZ has really allowed us to kind of not only talk about skill assessment from a care coordinator level or a supervisor skill assessment, but really say, this is what families are saying back to us. And so one thing that's been really instrumental in this is those 3 lines that you see, the green and the gold and the red, because understanding really what we're striving for with high fidelity, I think has increased the competition amongst all of the different sites. So at different standpoints, we're bringing this data with the understanding that we're trying to strive for high fidelity across the state of Indiana in webinars with supervisors and leadership. And like I think Eric and Heidi both mentioned, there's a lot more sites that should be represented on this graph. And so when we share this, and then we also share individual data with sites, many people realize they're not in the running. And so, trying to kind of come with the approach that you can't improve what you don't measure. And we've really got to increase those response rates and ensure that everybody is kind of tracking what families are actually saying about the approach. So when we look at coaching, I think we'll dig into a little bit more around specific curiosities that this data has given us as we look at different benchmarks in the Fidelity tool.
Yeah, and I'll also let Emily and others chime in on this one as well, because I am very specific to the WFI-EZ. That's the work that I do with Indiana, is specific to that assessment tool. But essentially, this slide shows that caregivers are more satisfied with wraparound processes when their families have access to services and supports, and when care coordinators are engaged. We see this through kind of combining the WFI-EZ with another, I believe John mentioned before, the WISP. And I'd love for Emily to chime in here as well.
Yeah, so hopefully many of you have heard of the WISP. If you haven't, it is a scoring tool that allows us to really track organizational accountability to the procedures and structure of wraparound implementation. And so what we know is that that has a huge, huge impact on the outcomes that families experience. So what we've done here, and John, please chime in because these are your charts and you can explain them much more eloquently than I could, but really looking at correlations between the data that Indiana has collected within the WISP for all of these sites that you saw on the previous slide, and what that looks like when you contrast it with the WFI-EZ. John, did you want to say anything before I talk any more about this?
No, yeah. So we're just much like the slides I showed right at the beginning. This is just looking at the satisfaction part of the WFI-EZ. and looking at levels of high versus low on these services and supports and care coordinator engagement measures from the WFI-EZ. So yeah, no, you're spot on.
All right. So, I think one thing that can often happen when we're working with organizations is we can put a lot of pressure on care coordinators to get the model right for families. And what we really have to do is, before we ever zoom into coaching, we have to zoom out to really look at the context. And so the WFI-EZ allows us to kind of have that zoom out approach and then pair it with what caregivers and care coordinators are saying. And what we see here is that, when youth and family have access to a more full array, a robust array of services and supports, caregiver satisfaction increases. And so this really matters. So when we're looking at organizations that might be kind of a one-stop shop, we know that that's probably not giving families that full array of resources. And so in coaching, really zeroing in on, okay, how as an organization are you partnering with other community entities to make sure that we're providing individualized services for families, because it truly matters to their satisfaction and therefore their outcomes. I think on this other chart, we also see that how frequent wraparound meetings are happening with families. That engagement between the care coordinator and the family truly matters to caregivers, and it increases their satisfaction on the WFI-EZ. And so alternatively, we're looking at what are we doing to assess skill with care coordinators and make sure that they're really true partners with families to make decisions not about them outside of the team process. So really looking at additional measures like the COMET to complement kind of our data story and understand what's really might be going on. So kind of that zoom out approach, I think, has been instrumental. Heidi, do you have things to add around specifics that we've done with this?
In regards to, so one of the things that was important to us was from the time a youth and family is approved for or enrolled in our program to the initial date of the first child and family team meeting, that phase 1 of wraparound was really important to us because we saw that CFTMs were occurring after 45 days for the initial. And so having this information has helped us to, when we coach, when we train, to really hit home, that families are in crisis when they come to us pretty much. And so what do we, there's a sense of urgency. So we really wanted to track that data from enrollment to the initial CFTM. So, because we had gotten back some qualitative data from families that said, gosh, it took me forever to get started, and that was not okay. So.
I think also other things like on the WFI-EZ, really looking at staff retention can really impact what you see in front of you as well, that caregiver satisfaction and care coordinator engagement. And so that's certainly been something that we've seen nationally as an issue, but being able to zero in on it in coaching through providing additional support around what onboarding looks like and how do we increase retention of care coordinators and supervisors, and being able to zero in on that through training as well as site visits has been a pretty instrumental place that Indiana's spent a lot of time in the past, probably 2 years, wouldn't you say? As well as transition, really looking at how families are disengaging and or successfully launching out of wraparound, and do we have really solid data around that, to kind of reference our title today, right? That garbage in, garbage out approach. And so Heidi's done a lot of work in trying to streamline data that then can be used to really understand what families are experiencing as they phase out of wraparound.
Yeah, we actually had changed all of our reasons in our computer system to match those that are actually in Rapstat. So we actually know when families are transitioning out, has it been a successful transition or not? So that was more of an outer level shift where we used inner data to affect outer changes. So
I know, so this webinar goes until half past the hour, but I know some folks probably have to hop off. So we'll finish up with some more examples of the data that have been collected. But I think for those who might be hopping off, you can see from the chat just what kinds of issues get raised when you actually have good data. So Taylor kind of went over all of the ways in which the nitty-gritty of getting high quality or high levels of data completeness and good response rates. But this discussion Emily and Heidi are facilitating here really brings home that then what you do with the data once you get it is really critical to actually having that kind of data informed environment. When you actually show folks results from the data that they're facilitating, your collection, and then you actually use it to coach and so forth, it becomes an organization. It becomes a learning environment, a state initiative, whatever the level may be, that actually is committed to data, and that also reinforces good data completeness. Everyone knows that it's actually going to be used. So yes, let's continue here. So what's another example of ways in which Indiana has taken the data they've collected and then made use of it?
Yeah, so these graphs are pulled straight from reports that I have completed for Indiana. I love, and there's a couple more charts that will show the one on the left that shows the difference between caregiver and care coordinator responses to the same questions for the same youth. Granted, you'll see at the bottom, there's a lot more care coordinators that respond to this, and that makes sense. Obviously, they're employed by a wraparound organization. They know more than caregivers do to expect to be reached out to for the WFI-EZ. But this is really helpful feedback to give back to organizations. The chart on the left is not as stark as the one I'll show you in the next slide, but this is nonetheless very helpful. And then on the right side, outcomes-based subscale. This is one of the subscales of the WFI-EZ experience section. And you can see fidelity data by organization. Of course, it's de-identified, but this is really helpful for organizations to see how they compare to others, even when they don't know who the others are necessarily, as well as comparing themselves to the benchmarks that we talked about previously. I don't know if Emily or Heidi wants to jump in here.
I think too, one thing that's been really helpful is, in looking at the WSP as well as the benchmarks, that those four primary questions that get asked to families around wraparound involvement, right? That when we look at those numbers just kind of outright, they don't look so bad. But the reality is that we actually need those to be, and again, Eric and John, just make sure I'm saying the right things, but 98% to 100% in order to even say that what we're doing is something close to fidelity practice, right? And so we need those to kind of make sense before we even look at some of these other questions in the WFI-EZ. And I think that has actually shifted the conversation a bit in Indiana and in other states to be able to really say, okay, these four primary questions, these should be overwhelmingly yeses, right? And if they're not, what does that say about kind of looking back at the way that we've set up wraparound in our organization and how we're kind of really operationalizing the values that we need to have in order to do good fidelity practice.
Yeah, it's what we kind of assumed that all wraparound initiatives would have scores of 90% or higher on these basic kind of expectations of wraparound, these A1, 2, 3, 4 items. But when you actually get good data collected and look at it across an array of organizations, not always the case. Another thing that pops out here is that 90% of the facility or the care coordinators said that they had a plan, created a plan with the family, but if only 83% of the parents felt like they knew that they had a plan, then kind of a point of coaching to kind of make sure that folks actually are creating these plans in a way that families feel like they own and are driving and are a part of.
And I will add to that too, for all of these charts, it's really helpful to see the discrepancy, especially with the wraparound involvement chart, that yeah, this should be 98 to 100%. And when I talk to families, or when I talk to caregivers, some of the most unfortunate but fruitful qualitative data and feedback that I get are from people who say no to any or all of those. And it really, I think, from personal experience of talking with them in conversation, can come back to it could be just a logistical structure of how the organization or that specific care coordinator is detailing or going through the process, but it could just be really about like family voice and choice and coming from a strengths-based perspective, because a lot of the families that say no to any or all of those are those that feel that they aren't included and that it is kind of forced upon them. And that is really important feedback to get. And I see Eric just flipped forward to the qualitative feedback. We have pages and pages of feedback, both positive, negative, neutral. And these are just a couple good examples. I'll read them out loud so that people can listen to them and not listen to me talk. So critique took us 4 months to even start. They didn't have skills coaches, even though they said they would. Our facilitator is very disorganized, no support to us, told us we were on our own in certain areas, looking for a new facilitator, but there currently are none. We were told we can't go to the county for help, county over for help. We've been badgered to transition, even though we are nowhere near ready. I'll read the compliment and then Emily and Heidi can chime in here too. This is changing our lives. We are getting services to help with attachment, which brought out a need, and the wraparound team was already in place to help us deal with that trauma. We will heal with their help. My husband and I are now on the same team and not against each other, with our daughter in the middle. Still working on things, but prayerfully it will get better still. And we can see in that compliment that there are pillars of what is part of the following wraparound faithfully or with fidelity, getting to those integral needs, having a team approach, really are highlighted in that qualitative feedback.
I want to add that when we do give back the data to our organizations during an annual training, we do give back this data too. It's de-identified, so if there's been a time where a family name drops the organization, we'll go back in and take that out. But in coaching and in being there with our organizations, when we look at the critique and we look at the compliment, it's always important for us to say, what if that is your organization? And so, we want to address it in that way. So gosh, we don't know if that's us, but what if it is? And then how do we make change? And where did it fall apart? So,
Yeah, absolutely. I think that because of the work that has happened in Indiana, I now often in other states say how rich the qualitative data can be, and to have somebody like Taylor on the other end of the phone to make sure that you're capturing some of this, because it has been truly instrumental in us really becoming more curious about certain trends. So specifically like what you see here, the 4 months to start, Heidi had referenced that earlier. We've actually given that timeliness data back to supervisors and leadership to let them know where they fall, and ensuring urgency is occurring to families and they're getting that plan of care within 30 days of enrollment, as well as kind of sharing with the whole state where all sites fall, de-identified, of course, just so that they know what the true issues are, as well as really looking at, to me, when I see, and we saw many of these told us that we were on our own in certain areas, really looking at that robust service array to make sure that this is a family plan and not just a youth-driven plan, which can often happen kind of as a misconception of what we should be doing in this model. And so really being able to take that back to leadership and talk about what types of services and supports they're aware of and that they're onboarding their staff around to make sure that families are getting a full holistic approach to this process.
Sorry, I skipped over this, Taylor. If there's anything more y'all want to kind of comment on this last example of the actual quantitative data, feel free.
Yeah, just to highlight real quick, I'll just say, so this is just to break it down. The fidelity scores total and subscale, breaking it down by the subscale, care coordinator versus caregiver. This is another really helpful set of data, as well as the outcomes on the bottom left in terms of the discrepancies between care coordinators and caregivers input. This is super helpful to give back to Heidi and Emily, and I'll let them speak on that. But it's really interesting, some of the data that has come from this in terms of, yeah, why are those discrepancies there? What do they tell us about what's going on at that organization? And then in the upper right, the response rates by caregivers. This is helpful to give back to organizations to let them know maybe they need to give more frequent reminders that their families could be reached out to, and just really letting them look into why maybe our caregivers not responding to these. What can we do to change so that our response rates as an organization increase?
I know one thing that's been helpful for us too is having those benchmarks. So that's been huge, because I think sometimes our organizations may not have known, what is the threshold, or there was rumor from back when, what really does determine, the score of high fidelity. And I think breaking things down with the benchmarks has been helpful to share with our organizations so they can set organizational goals around implementation and where that fits, whether that be, around natural supports or whatever. And then even us being able to use that in training has been important too.
Well, I feel like we have hit a lot of these points, but let's let Emily and Heidi sum up any other kinds of ways in which they've used these data. And again, give props to Taylor. I mean, I know for those of you who are left, you're the real data geeks in Wraparound, right? We lost a few folks, but those of you who are still hanging out, we know who you are, and we love you. We want to help you with this kind of path that you're on towards getting and using data to inform your Wraparound initiative. So you can always just contact us about getting support to help around that front end of getting the high quality data in. But we'd also love talking about how we actually make use of those data. So any last thoughts, Emily and Heidi, about how you've used these data to inform your work?
Well, I'm first of all going to give a huge shout out to Taylor, because this work is a lot. And if it was not for us having Taylor in a protected role, as I had mentioned earlier, and being our person for this project, myself, my coaches, we have 5 certified INWIC coaches, but we do not have the bandwidth to do this. So our partnership and having someone in a protected space to do this has been wonderful.
Thank you.
You're welcome.
Yeah, I can't really emphasize enough that if you just have somebody dedicated to getting the job done and don't cut corners, make sure that you do whatever it takes, you will get these data. That's all it is. Not that Taylor's not brilliant, but it's about assigning folks the responsibility, looking at the data to see how well your data collection rates are going, and actually just problem solving along the way. It is doable, and it's just remarkable how often states and organizations will say we can't get these data, and it's like, no, it's possible. Just got to do whatever it takes. Anything else from our Indiana experience before we finish up with a little bit about how Rapstat can support some of the things that Taylor and Indiana just kind of made happen before we had Rapstat?
Yeah, just a few quick points, because I know we're getting pushed on time. One of the things I think in bullet number 2, reviewing statewide trends and investing in system fixes has been really important to us. I mentioned before about the time it takes from enrollment to the initial child and family team meeting, but also we looked at our data, information around referral. We've also have built out an entire statewide access point for our families, so the providers aren't the ones that are doing the assessment, that families are truly getting voice and choice of their providers and who they want to partner with. So that's kind of been some outer setting type of system changes that we've been able to do, along with changing our reasons for transition out of our program here in Indiana. So, we take this stuff and look at it, we zoom in, but then we also have to zoom out, like Emily said, and really pay attention to those outer layers, because if we don't have a state that's supporting and implementing correctly, then we just end up with organizations that are just doing wraparound, and it doesn't attend to the whole shift and the system impact that wraparound can have on a state. So, Emily, did you have anything else you wanted to share?
No, I think it's just being able to have that comprehensive picture has been really helpful also in identifying trainings that we may need to look at for staff and supervisors. And so I just want to give, credit to all of the coaches that you all have, because they truly do analyze this data. And then, it's increased onboarding trainings, crisis trainings, focus on relational stance, because we saw some of the data sets that we saw earlier. And so it's been really, really instrumental in kind of inspiring the workforce as well.
Yeah, we really do use those A 1 through 4 and D 1 through, I think it's 4. I'm trying to remember off the top of my head, but to really dive in and look at what we need to do to support our organizations. And the use of the WFI-EZ.
Yeah, Heidi, there's an interesting question here. Have you had negative pushback from staff when making adjustments, applying the data in areas of needed improvement, or difficulty when shifting the focus of the WRAP program to try to improve a specific outcome?
I think it's how you coach to it, honestly. So if you're coaching and you're using data, it takes out that blame part of the data. It's not that someone might be doing wraparound wrong, but what are building strength within staff. So not really a lot of pushback, because it just really, with the process being so parallel and strength-based, I don't think we've had a lot of pushback that's real difficult that can't be shifted through process-based supervision when it comes to that partnership with a wraparound facilitator and their supervisor. We've had some pushback within, organizations that are like, gosh, do we have the time to do this? Well, yeah, we do have the time, because families, we can't wait any further. So this has just been wonderful, using the WFI-EZ with the WISP, with the COMET, and then everything that we do is driven by data. So it's not like, oh, we just think we're good, or we think this is the area where we need improvement. We actually know, and we can coach and attend to that through tasking and through the coaching model with NWIC.
All right. I know we spent a lot more time on this than we necessarily thought we would, but we shouldn't be that surprised, right? This is the richness of the work is beyond the data. It's about using the data. So what are some ways in which we have tried at the UW Wraparound Evaluation Research Team to support this more systematically? We certainly love making folks like Taylor available to states like Indiana, but each state initiative or big organization that has an evaluation budget is going to have to find their own Taylor in most instances. So what did we do? We also created something called Rapstat that's trying to support some of the kinds of things that Taylor in Indiana implemented as part of their process. So Rapstat, if we look at the kind of logic model here, really steps in at the fidelity and the outcomes level of what we're trying to collect to manage. Things like the WISP and other kinds of data that are important will have to be things that are collected separately from Rapstat. But Rapstat gets at a lot: satisfaction, here outcomes, and so forth. And Rapstat takes over here. So some of the key data elements supported by Rapstat that are kind of part of an ongoing process of entering data on the youth that you're serving. You have real-time data on how many youth you're serving, what their the length of enrollment in wraparound is on average. Your caseload sizes are things that get entered on a regular basis by wraparound organizations that are licensed to use Rapstat and our fidelity tools. We collect these wraparound process outcomes. And then the youth and family outcomes that get collected are reasons for discharge, which we often don't even have a rate of successful discharge as an outcome. We'll have wraparound programs or initiatives who can tell us what their fidelity scores are, but they don't know what % of youth discharge successfully or were able to be maintained in their home and community during the course of their stay in wraparound. So Rapstat captures these minimum outcomes along the way. Then what do we do to actually promote this rigorous data collection so there's not the GIGO issue, the garbage in, garbage out? Rapstat allows you to do random sampling. It allows you to enter the parameters that you want to use in there and then pulls those random samples for you from your youth roster. And then there are a whole array of different things that help you track your data collection success. So you can manage the data collection in a way that, you know, maybe not as individualized and tailored as Taylor has done in that Excel spreadsheet that she shows you, but it does facilitate some of this stuff. So again, Rapstat functions were built to encourage data collection success, allows you to set your rules for sampling and then pull in your representative sample for you, and then tracks the degree to which you have successfully actually gotten surveys back for those in your sample. It will email respondents a confidential link to you know, a HIPAA protected secure surveying kind of system, and basically administer the WFI-EZ online once they click on that link. And it will help you, again, keep on track with updates on your data collection success, whether incentives were provided, and so forth. So here's just some screen grabs that show how this works, right? So if you are using our fidelity tools like the WFI-EZ and using Rapstat, you would enter your youth roster, and then when it's time to pull your sample, you know, you go in there and you select which forms do we administer and which forms do we want to pull a sample for. And you can toggle yes or no for all 4 forms. You can say whether you want to track incentives, whether you want to track consent having been obtained if you're collecting consent. Again, I don't think that that's something that everyone should assume you have to do, but if you do, you can use Rapstat to track that. Which sites are you going to actually be pulling from? You can select which sites. And then a whole bunch of other kinds of things. Do you want to include recently discharged youth or only active youth? What's the length of enrollment, minimum and maximum, that you're going to pull your sample from, and so forth. So other things, WFI-EZ text message feature, send customizable emails or texts to participants. So you can write the script, put it into Rapstat, and when it's time to actually send out all of the surveys, like Taylor said, was step 1. Just hit a button and it will send out the customized message and the links to each of your respondents. Let's see. So then once you've done all of that, it will actually do that tracking of data collection and tell you whether your incentives have been dispersed from the data management page. It'll show you what your progress is towards the number of surveys. So in this community, the random sample was 12, and you can see that they've got 11 out of 12, and they have, you know, they've got a few days left to get that last survey. This is something that automatically comes back to those who are using Rapstat. And then finally, it can give you details on for which organizations have you had the surveys returned from. So you can do that kind of organization by organization review of data collection success that Taylor does manually. And then finally, here's your Rapstat dashboard. Once you actually get those data and it's flowing, you can look at your fidelity over time. You can look at your outcomes over time. You can look at your number of youth you're serving, and so forth. Okay, we have gone way beyond the time we thought we'd be spending, but we did answer some questions along the way. The slides are available at the National Wraparound Initiative website, nwi.pdx.edu. Rapstat is something that, to answer a question I'm seeing here, Rapstat is something that you have access to if you license any of the fidelity tools. So the WFI-EZ surveys is one. We also have the team observation measure and the document review, document assessment and review tool, or the DART. And Rapstat supports the data entry for all those, as well as all the kinds of functions I just described. It wasn't cheap to develop. It's gonna be real honest. It's pretty sophisticated. Hopefully it's been supported, felt like a good additional support to those who've been collecting these kinds of data out there in the field. Still kind of being tweaked and refined, but this is something that you get along with licensing use of the tools. And frankly, what it's going to do is allow us to do a lot more good research on wraparound outcomes and what drives wraparound outcomes, because, you know, in a confidential fashion on the back end, we'll be able to see, you know, how does fidelity relate to those discharge success rates and to those community outcomes, residential placement, and so forth. So yeah, our ulterior motive is really sinister. It's to actually keep building the research base on wraparound and systems of care. So I think, so one last question here, is Rapstat able to be utilized by a wraparound program designed to serve adults as opposed to youth? Absolutely. You just have to ask whether or not the fidelity tools are relevant to the population you're serving and the model you're using. I'm not sure exactly what it is, but it shouldn't really matter. But the main question is just whether the fidelity tools themselves are relevant, because everything about Rapstat is about supporting the data that you collect using the fidelity tools. I have a really good question here. Kelly is still on. What time did you determine is the best time to call caregivers? I'm curious to hear that myself. Is that actually something you have data on?
I don't have specific data like in something I can pull up, but that is a great question. To be honest, it's not what you would expect. I have found the best, well, I guess you don't know what to expect because it's all new and everything, but the best results I have found are typically on Thursdays and Fridays. In terms of time of day, it can run the gamut, because if I start making calls at 11 a.m., if everybody answers, I could be on calls until 4 p.m. So it really, I was just surprised about that, but maybe it's because people are ready for the end of the week and they're getting sick of work or something. I don't know, but I was surprised that people were more available later in the week.
We'll have to do a research study on that. People are also asking an interesting question, which you may or may not have any kind of data to inform, which is, you know, so let's say you start with 100 families are enrolled, your random sample is 40, start with 40. What is the rate at which you successfully get those surveys from the survey? I'm sorry, the web survey versus the phone calls versus the mail-in? Like, you know, is there kind of a...
Also, there is no data for that, because when I receive the consent forms, often, I would say more often than not, and this is starting to change actually, but more often than not, families do not provide email addresses, so they immediately go into the call bucket. I am very happy whenever I see an email address listed, and recently actually there's been a huge spike in email addresses being listed. But it really depends. I know that's not helpful, but every family is different, and some people don't check their emails and some people do and they think it's spam. I would probably think it was spam if I saw money, you know, like if I saw, I don't know. So it really
Answer a survey and get paid. I've never seen anything like that.
Exactly. Sorry, that's not the most helpful answer.
Yeah, well, I think that really speaks to why it's so important to have this be something that the care coordinators or facilitators are also reinforcing, like, what is this? And, you know, playing a role in the process. Well, folks, we are out of time. Again, thanks to Emily and Heidi for joining us, and obviously Taylor and John as well. You can always email us at rapeval@uw.edu if you have follow-up questions. The slides and the recording will be posted on the NWI website in a few days. John and Taylor, let's make sure we get the final deck to Janet and her team, and we'll get it up.
Thanks, everyone.
Take care, everybody. Have a great rest of your week.